now.
Am I good?
Yes.
Okay. I'm going to show you the two-way irrigation system for the catheter. I am, of course, always going to introduce myself, identify the patient. We are always going to make sure that we follow agency protocols, state and federal regulations, safety precautions, privacy. We also make sure that we are practicing universal precautions as far as making sure we have gloves and we are washing our hands. We're going to practice good body mechanics. And I think that's it. So the first thing we're going to do is we're going to gather all of our supplies.
Oh, wow.
We're going to gather our supplies. If they do not have an indwelling three-way indwelling catheter, we're going to make sure that they do. We are going to grab our glycine solution. The first thing that we are going to do is we are going to take our tubing and we are going to make sure that they are closed.
Okay.
We also want to make sure that we are never disconnecting the drainage tubing from the catheter bag. So after that, we are going to spike our solution here, actually before we put it up on the IV pole. And then after we have spiked it, we are going to place our bags on our IV pole. Let's see. And we are going to make sure this is closed. And we're going to prime it and get all the solution. Actually, we're going to undo this and we're going to hold this over a sink, and we are going to just kind of slowly let the solution fill to the end, and then we're going to ensure that we close it back off and place the cap right back on it. For the patient, we are going to make sure that the privacy is ensured, that the only thing that is visible is the irrigation and openings, tubings here. We want to make sure that we put a towel over the top half of them, that we are also making sure they have a towel underneath them, so we can protect their bedding and cut. Okay, the next thing we are going to do, we are going to get our tubing. Okay, before we start, we are going to make sure that we empty our drainage bag and that we get the output and we document it. We are also going to ensure that we have alcohol swabs or antiseptics, and we're going to make sure that we
Go.
Okay, before we take this off, we are gonna clamp the top here so then there's no urine flowing out. Again, we're gonna make sure that we clean the outside of the ports here, and then we are gonna go ahead and connect. We are gonna take our little roller here and very slowly start our solution through the tubing. We're going to monitor them for 1 to 2 minutes. We are going to use our sterile solution. We are going to pour up to 100 milliliters in our sterile cup or container. Over here, we're going to also make sure that we are cleaning the ports out with alcohol swabs. We'll make sure that it's clamped. We're going to go ahead and draw between 30 or 40 for catheter irrigation, and between 100 and 200 for bladder irrigation. And we are just going to draw and stick it in the port here. And then we are going to push the solution in. We are going to continue doing that until we have reached the prescribed amount by the doctor. If you need any resistance, you can go ahead and have the patient kind of turn slightly. If you meet resistance again, then you would call the physician. When you are through, you would unclamp it unless there is a specific time that is listed for unclamping it, then you would keep it there. But then you would make sure that you would unclamp it and make sure that you have the bag on a non-movable part of the bed. And then you would remove your gloves, you would put the patient in a comfortable position, make sure that the bed is lowered, and call itis in place.